Now let's see about cell death. So cell death. So cell death, it is irreversible. As it is death, it is irreversible. So let's consider this is our cell, this is nucleus of cell, and it is having stress, which may be physiological or pathological. So due to stress, it will undergo adaptation. But if the stress continues, then this will lead to the cell death. And the cell death is further of two types, as apoptosis and necrosis. So this apoptosis is the programmed cell death inside the cells, but this necrosis is, this apoptosis is like cell suicide, but this necrosis is like murder. So first let's see about apoptosis. So definition of apoptosis. Apoptosis can be also called as programmed cell death. But what is the definition of apoptosis? So definition of apoptosis is, it is microscopic form of cell death mediated by intracellular enzymes (caspase). It is both physiological and pathological, and not associated with inflammation. So this is apoptosis, definition of apoptosis. Now let's see the mechanism of apoptosis. So this apoptosis occurs in two phases, that initiation phase and execution phase. So first is initiation phase. So first, initiation phase. This initiation phase has further two pathways. One is intrinsic pathway and other is extrinsic pathway. Second one is execution phase. Which is common for both intrinsic and extrinsic pathways. So first let's see the extrinsic and intrinsic pathways of initiation phase. So we will make heading as initiation phase, and we will divide this into the two pathways. One will be our extrinsic pathway and other will be our intrinsic pathway. So let's see the mechanism of extrinsic and intrinsic pathway in the initiation phase of the apoptosis. So in extrinsic pathway, as the cell experiences any so on the surface of cell there are some receptors which are known as Fas receptors or CD95 receptors, and there are some ligand, that is Fas ligand or CD95 ligand. So this fast ligand will come and bind to the fast surface of the fast receptor, and as the fast ligand comes and bind to the surface of this fast receptor, these multiple fast receptors come close to each other and will lead to the formation of fast associated death domain. So let's see how it is formed. So here these multiple fast receptors come close to each other and will lead to the formation of one domain known as fast associated date domain, FADD, fast associated date domain. And this fast associated date domain will convert procaspase. This fast associated date domain will convert procaspase (8) and 10 into active caspase 8 and 10. So this is our extrinsic pathway. Now let's see the intrinsic pathway. So in intrinsic pathway, inside the cell, this is nucleus and this is mitochondria. This is inner membrane of mitochondria, this is outer membrane of mitochondria. So between the inner and outer membrane of mitochondria there is one intramitochondrial membrane protein which is known as cytochrome C. So this cytochrome C plays important role in the intrinsic pathway of apoptosis. So in this outer membrane of mitochondria there are two types of protein. One is anti-apoptotic proteins and other is pro-apoptotic proteins. So anti-apoptotic proteins are BCL2, MCL1 and BCLX, whereas pro-apoptotic proteins are BARC, BARC, BARD, BIM, BARCs. BARC, BARD, BIM, BARCs. So these are pro-apoptotic proteins. The anti-apoptotic proteins will inhibit the exit of cytochrome C into the cytoplasm, whereas the pro-apoptotic proteins increases the permeability of outer membrane of the mitochondria, due to which the cytochrome C comes into the cytoplasm, and in cytoplasm this cytochrome C. So in intrinsic pathway, what happens? The anti-apoptotic proteins will get deactivated, whereas the anti-apoptotic proteins are replaced by the pro-apoptotic proteins, and these pro-apoptotic proteins will increase the permeability of outer membrane of outer mitochondrial membrane. That's why the cytochrome C will come into the cytoplasm, and this cytochrome C will convert procaspase 9 into the active caspase 9. So here one step is there that the cytochrome C will come into the cytoplasm and bind to one protein known as APAF1. So this is also an important step. It will bind to APAF1 and convert procaspase 9 into the active caspase 9. So this is the intrinsic pathway of apoptosis. So now we have completed the initiation pathway. Now let's start with the execution pathway, that is execution phase of apoptosis. So in execution phase, from extrinsic pathway there are active caspase 8 and 10, and from intrinsic pathway there are active caspase 9. So this active caspase 8 and 10 comes, this active caspase 9 comes, and they will activate caspase